Well, Dr. Gold, you explained farsightedness and nearsightedness and explained that LASIK surgery, epi-LASIK surgery is applicable for both of them and is for all purpose everlasting, except sometimes some people might, a very small percentage, 1, 2, 3% might here and there need a small adjustment, but that's not the end of the world either. That's just, going in for a little tune-up. Less money than the original surgery, less complicated, less time, all kinds of things. Now, apparently this LASIK surgery also operates for reading, people who cannot read. Now, I always thought that had to do with, having a nearsighted problem, because I can't read. Like, I do have 99-cent reading glasses, and they seem to be doing the trick for me. They're 2.5, I think, or 2.75, or something like that. And so reading, is that a different thing than being nearsighted?
In reading deficiencies, the problem is that the focusing muscle inside the eye will no longer focus light rays up close to your face. And so basically we are treating farsightedness relative to your reading distance. And so it's the same kind of treatment that we use for farsightedness. We make the cornea steeper, but we only treat one eye. We treat the non-dominant eye, then we create a system called monovision. It's a little bit difficult to understand if you try and intellectualize it. So what I do in that case is I have people come in and I actually put a contact lens in their one eye for a trial. We just do it right in the office and show them what it would be like to be able to read without those reading glasses anymore.
Interesting. So you're basically balancing, it's the yin-yang, you're balancing the strong and the weak, and then all of a sudden the body goes, somehow adjusts it, and all of a sudden sees again and can read.
That's right. We can't identify the structure in the brain that allows monovision to work. We just know how to create it. And we choose the dominant eye to leave alone for good distance vision, and we correct the non-dominant eye to read up close. Now, in people who also are nearsighted or farsighted, they may still need both eyes corrected, but if they're in that 45 and up age range where bifocals are appropriate for them, we can correct the dominant eye to see fine for distance and the non-dominant eye to see fine up close.
Got it. So because a person can obviously, as a person gets older, he has a tendency to become having a farsight problem. He can't see the signs on the road anymore. And that's just, at the same token, however, he might have the reading type of problem. So basically, for all purpose, the way you look at it, if that happens, I'm apparently not there yet. You start going blind. I mean, you don't see far, you don't see close. The name of it doesn't really pay any attention. You simply start seeing blurry all over the damn place, right? And
blurry is the appropriate word. Blind is not the appropriate word.
I would, yes, I agree. So you start. So now in this case, what you do is you fix the reading problem by adjusting one eye, and it's the non-dominant eye. And at the same token, however, you adjust on both eyes the farsightedness problem, and it's all done in one surgery, or does it take two sets of surgeries?
No, it's all done in one surgery for people who are already in bifocals. For people who are younger and haven't yet required reading glasses, and then later on, after their initial surgery, they get to the point where they may need reading glasses, then we can do the monovision by recorrecting one eye.
Got it. Or is it also workable the other way? Let's say you recorrected one eye because the guy had needed reading glasses and 30, 40 years old, whatever, and then all of a sudden 60 comes and he starts having the farsight problem. Can you then still go in and fix that?
You always can, but it really doesn't happen that way.
I see. It doesn't happen that way.
No, not really.
Well, how come then I have reading glasses, but yet I still seem to be seeing quite fine in the distance. Couldn't it be possible that my distance goes out to one of these days?
It's possible, but not real likely.
I see. So, because my distance hasn't gone out at this moment, at least not as far as I noticed very much, there might be a dimmer switch built in and it has gone out compared to what it was. But since it hasn't gone out, most likely, it will not really happen anymore. Okay? Now, question...
Probably not.
I got it. Probably not. And if it does happen, you could do the surgery.
Yes.
Good. Another question. If I come to you tomorrow and say, look, I have these reading glasses and I really want to get rid of it, because frankly, Dr. Gold, sometimes, this thing is a hassle. I mean, because every so often there's something you need to see now, and by the time you get your glasses, it's gone. You don't see it anymore. Or I park out of the car because I was, looking at my cell phone and text something, and anyway, there I am and have the glasses on, and I keep, turning and parking out, and I wonder why the parking lot is very dim. Because I don't see the rest. So I run around with my glasses very often like this, and so it goes faster. So the point is, if I come to you tomorrow, you will obviously do an examination, and you might also point out to me and might say, Helmut, you think you don't have a far sight version, but actually you do. You just got so used to it that you're right with it, but no, you do. You used to see better, there's no doubt about it, I'm sure. You would notice that with your examinations, wouldn't you?
Absolutely.
And then you would do both surgeries at the same time.
That's right, and I see that very frequently.
I'm sure you do, because in every area in life, frankly, gaining weight, losing muscles, getting slappy, it is such a small dimmer switch. It goes boom, 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 and next thing you know is, the kitchen is a big stall because you got used to it while your wife is gone, not to wash the dishes for one day becomes 5. It just in everything goes so slow that you don't know anymore the actual good state, which is happening. Well, this is very interesting, I think so. Thank you very much for shedding light on it. Anything else you think you should add to it?
Aging is no fun.
And here we all want to get old. We keep taking vitamins and all kinds of things to get old, and yet it isn't all that's cracked up to be. Huh?
Right. It is better than the alternative.
Yes. And, obviously medicine in your area, and I talk to some other doctors, I think if you use it right, don't overdo it, and don't try to look for the magic pill, meaning the instant gratification is really what I'm talking about when I say magic pill. It's that tendency of instant gratification which actually makes medicine sometimes being a handicap, in my humble belief. That's just me. If it would be a little bit more... You see, I see people doing that all the time with everything in life. Something new comes up, they drop the old. Well, new medicine comes up, that doesn't mean exercising, normal good eating, and whatever it might be, it is outdated. But apparently we believe it is when something new comes up.
I agree with you.
Yeah, and if we would keep both in it, not easier said than done, I agree with it. I think medicine... with no doubt, it's quite amazing. I mean, I look at people getting 2 hip operations and 3 days later literally are dancing again and things like that. I mean, it's wonderful, how medicine keeps us there. And what I hear from you from the eyes, it's just absolutely gorgeous. Thank you very much, Dr. Cole.